Imagine a Louisiana where everyone has the opportunity to lead a healthier, more prosperous life. That's the vision of Healthy State. By engaging healthcare, community, education, and policy organizations from across the state, we're working to tackle the leading causes of poor health together. Ochsner Health provided the initial funding, resources, and expertise to kickstart this united effort. But Healthy State is about collective action through our Healthy State Alliance. Healthy State inspires healthier lives and stronger communities through partnership. We will build a more equitable and healthier Louisiana by bringing resources to underserved communities, raising awareness of the impact of health and social conditions using data, technology, and innovation to improve outcomes, and investing in Louisiana's economic growth and workforce. Regardless of our backgrounds, we're united by a common goal: to build a healthier Louisiana where families, neighbors, and friends can thrive. Join us in shaping a healthier future for our state. Together, we can make it happen.
Give a warm welcome to our Session 3 panelists. Sonny Lee, son of a saint. You all can come up and be seated. Dr. Michael Rolfsen of the Baton Rouge Clinic. Dr. Toni Flowers, LCMC Health's Chief Diversity Officer, and our moderator, Christy Reeves, Ochsner Health's Vice President of Community Engagement and Impact. This session is called Own It, Courage and Leadership to Drive Change. Our moderator for this session is Christy Reeves. Christy leads Ochsner's Health's external community engagement strategies across all regions. If you're in the room and haven't met Christy in the last 10, 15 years, you just haven't been anywhere, because she is literally everywhere. She is known for her ability to forge strategic partnerships that align with Ochsner's business goals. She has a proven track record of bringing diverse groups together to drive impactful community initiatives. Dr. Toni Flowers leads diversity, equity, and social responsibility efforts at LCMC Health. A nationally recognized leader in health equity, she has provided training and coaching for healthcare diversity practitioners across the United States. Dr. Flowers has received numerous awards, including recognition as a health equity pioneer by the American Hospital Association. Sonny Lee founded Son of a Saint in 2011 to transform the lives of fatherless boys in New Orleans. Today, the organization serves over 350 youth through mentorship, life skill development, and scholarships. Prior to founding Son of a Saint, Sonny worked for the New Orleans Saints and Pelicans and the New Orleans Jazz Institute. He holds a degree in marketing and management from the University of New Orleans. Dr. Michael Rolfsen is an internist at the Baton Rouge Clinic with a focus on preventative maintenance. I'm here because he keeps me healthy. He has extensive experience working on public health initiatives, particularly related to smoking cessation and managing chronic diseases. Dr. Rolfsen actively engages in community health programs that address the social determinants of health, and he currently leads a very important program looking at a task force that was created by him on food security for the Baton Rouge region, after discovering that we have alarming numbers of people, including children, who go to bed in our community without having dinner or supper each day. It's a very important work. He's passionate about it, and his leadership has led the progress that we've made in that area. Christy?
Thank you. Owning courage and leadership isn't just about having the initial spark to make a bold decision. It's about claiming that courage as a core part of who you are as a leader. It's recognizing that courage is not a one-time act, but a continuous commitment. It's about showing up day in and day out, even when you're unsure of the outcome. Owning courage requires us to consciously choose the harder path, to speak up when it's easier to stay silent, to take action when it's safer to stay still, and to stay authentic in environments that often reward conformity. It means leaning into discomfort and uncertainty. The journey's never easy, and it comes with personal and professional cost. The reality is it's scary. It's scary to own your courage because it asks for a moment of bravery, it demands intentional action, it requires leading with heart while embracing the fear that comes with it. Today, we're going to talk not only about what it takes to find courage, but how to truly own it and the impact that it can have on your organizations, your teams, and the communities that we serve. Our participants, our panelists, are examples of what it looks like when leaders take bold actions. They've seen the needs in their own backyards, felt a personal call to act, and have turned their vision into impact. John introduced our lovely panel, and we'll hear their stories. But while you're listening, I encourage you to think about what it takes for you to own your own courage. Let's give a warm welcome to our panelists. I'm going to give each of you a second to just tell this group a little bit about yourself that maybe they didn't hear in the bio. So I'll start with you, Sonny.
All right, I love going first here. How's everybody doing? I'm really blessed to be here today with you all, share a little bit about my background and what I've learned. But I'm from New Orleans. I was born and raised there. My father played for the New Orleans Saints, unfortunately passed away when I was 3 years old, died of a heart attack at the age of 36. So it was my earliest and only memory of my father in front of me. And so I was raised by powerful women in my family, my mother, my grandmother, my aunt, my older sister, and had a great upbringing. And so from there, went to UNO and then had some great work experiences, which led me to starting Son of a Saint, which I'll share a little bit more about in the future. But for me, it's all about supporting the next generation of kids and making sure that they're self-sufficient and giving back to their community. So I'm very grateful to be doing this work every day.
Thank you. Dr. Flowers.
Sure, so much to say. I think one thing that is important that's kind of given me the North Star for my life and for my career is that my family is a very unique family that we are able to trace our roots back as an African-American family to pre-Civil War and back to a shaman and a enslaved woman. And they had 16 kids, and some of their kids had 18 kids. So we say there's a lot of wildflowers and a lot of domesticated flowers in our family. But you can figure out which one I am later. But what we realized is that coming from that shaman, that Cheyenne shaman, he was very focused on healthcare and providing healthcare for not only the people that were on the plantation, but our family. And so our family is filled with healers. And I'm a registered nurse, my mom's a nurse, my sister's a nurse. It's a disease that runs in our family. And so I think the fact that we were born to be healers, we just haven't found it on a genetic marker yet, but we believe that it is there. So recognizing that I kind of grew into this. My mother was in nursing school while she was breastfeeding me. And so I think some of that came across the, and then my mother decided to go back to school to become, she was an LPN, become an RN. And somehow we ended up being at the same point, and we ended up going to nursing school together. I don't advise that. My mother was the center of embarrassment for me often. And so she would do things like say, well, why do you score so close together on the test? And she would say, well, she's a breastfed kid, so what's in me is in her. But having a mom that was so focused on caring for people, caring for others, we probably had, I think, a matter of about 30 people that have lived with us throughout my lifetime. And so I thought she should have gotten paid for that. And all I found out was that I just ended up having more aunts and uncles and cousins that didn't have our same last name. So I think those things, being a healer, caring for people, was something that was germane in our family, and certainly that drives me every day to make sure that people are cared for to the highest level of quality and safety, regardless of who you serve, regardless of what language you speak, regardless of where you're from. And so that's some of the things that really drive the work that I do every day.
That's amazing, and I'm so glad I'm not Dr. Rolfsen right now having to follow those comments. But I'm going to turn it over to you.
I was thinking the same thing. But I think, like Dr. Flowers, I attribute a lot of my community involvement to my parents and the example that they gave. I'm the second of 7 children, and I have 5 children myself and 10 grandchildren, and 1 on the way, so 10 and a half, I guess. But one of the things I find is of my 5 children, only 1 moved back to Baton Rouge, and it's been alluded to earlier today a number of times. One of our really goals, a lot of us want to see our kids want to move back here. We want to bring our families back to Baton Rouge. So, I think it's important to do whatever we can to make this a healthier state, a more inviting state for people to come back. I'm currently a practicing physician. I practice internal medicine at the Baton Rouge Clinic. Been there for, I don't know, a while, and busy with that as well as with my family. So anyways, I think that's the important thing to me, is getting this state to be the kind of place that everyone wants to come back to.
Well, you're all very inspirational leaders, and we're delighted to have you, and you have amazing stories. You're here at Healthy State Summit, and I'd love to hear what inspired you to be part of this initiative. Was there a defining moment that made you come to this, and is there a through line in that work with the work you do day to day? I'll let any of you start.
I'll go first this time.
All right.
So when I was interviewing for this role, what attracted me to the role was a couple of things. One was I've been a chief diversity officer, the first at 2 organizations in 2 different states, but the fact that the title was Chief Diversity and Social Responsibility Officer. And the other roles, I've had to convince my leaders that we had a social responsibility where health was concerned, but that my CEO, Greg Fern, created the title. And I would tell you, for at least the first 3 months of my job, whenever we were in a meeting together and I was introducing myself, Greg would say, "Tell them about the title, Toni." That was something that really, really grabbed me, and it grabbed my heart, because I recognize that people have lives outside of the days that they're in our hospital. And it is, as I've said before, about 20% of what happens to a person's health happens within the walls of our hospital. That other 80% is outside of the hospital, in their neighborhoods and in the places that they work and that they serve. And so we have to be mindful of both areas where they are. So when I was invited to be a part of the task force, to me it was a great moment, because I'm still getting acculturated into New Orleans. It'll be 4 years in March, y'all, so I'm working on my y'all and my Rouge. But nevertheless, the issue for me is there's so much good work that's happening outside of hospitals, but often it's happening in silos. I think the beauty of a healthy state is that we're bringing everybody together, because we are stronger together. I mean, if you think of your fingers do work independently all day, but when you bring them together, the power that's within it. And I think that that's what healthy state means to me. And I think also, as we're working at our health system, as we're working and recognizing that we can bring our community-based organizations together, we strengthen the work that they do, and they strengthen the work that we do.
I'll let you go last this time. This was an easy question. When they said, what made you decide to get involved with this? I was asked to represent the Baton Rouge Clinic on the Ochsner Healthy State initially, the Healthy State project, whatever. And it was a meeting they had, probably a year and a half, 2 years ago. And it was after lunch, and everybody was kind of starting to doze off like you guys are. And it was a talk on food insecurity. And as everybody's kind of sitting there listening to the statistics and whatever, John Spain stood up and he said, "I want to know, where is the moral outrage in this group that we have children go to bed every night hungry in our community? Where is the moral outrage?" I was like, oh, okay. So I went up to John after. I said, "John, I'm outraged. Let's do something." So we talked about it, and I said, "Do you think it would help? I mean, I know this guy and that guy, and some people that might have some impact and some influence, and would it help to pull people together?" He said, "Yeah, let's do it." So we made a few phone calls and got people together, and it was amazing the inertia that started there, as we started talking about it, everybody wanted to add, okay, well, why don't we invite this person to come and that person to come? And suddenly we had a whole room full of like 20 people that all had different inroads, different inputs into food insecurity and ways to deal with it. So I kind of blame John Spain for the moral out. In fact, we called our group the Moral Outrage Group at first. Didn't have a very good ring to it, so we actually had a PR firm that worked with us, and they used ChatGPT and came up with the name Alliance to Defeat Hunger. So we are the Alliance to Defeat Hunger. It's a good name, but that kind of represents what we do.
Very good.
All right. I think for me it was a personal experience, as said earlier, growing up without my dad and having the challenges of navigating my young adolescent years, I guess. I didn't have dad in the audience or in the crowd when I was playing baseball or tennis or debate or whatever. I didn't have that. And so it was challenging for me at the time navigating those things. Fortunately, I went to St. Augustine High School, and most of you may know, out in New Orleans, where I was there and really saw what the expectation was for me from black males that were teachers and that were paddling me too, because we had the paddle back then. But it was a lot of discipline that I got. And St. Aug, without St. Aug, there is no son of a saint, I will say that now. But going on to my professional career and being able to travel a tremendous amount was very impactful for me as well. I did a lot of volunteering also in my early years, but there's something that happened when I was 29. It was after a Saints game, actually. It was in October of 2010. And actually, we lost that game, and I was with my sister downtown New Orleans, and we were having a glass of wine, and I looked down at NOLA.com, and I saw that there was a boy that murdered another boy. And I did some research and found out that they both lost their fathers to violence. And so I already did some mentorship programming with Big Brother, Big Sister at the time in New Orleans. I did that for a year, but saw that I could probably do something a little bit different than really how it was being run. And so what I did is just started the nonprofit January 1, 2011. And the first board meeting, and by the way, I got board members that I didn't want to make mistakes in front of, or that I was okay making mistakes in front of. So, the dentist, the doctor, the lawyer that were my friends. And so at our very first meeting, I said, look, I want to help single moms, honor my mom and help them with finances to help support their kids with, whether it be sporting equipment or a trumpet for music, help in any way. And so they said, Sonny, tell us your story in a deeper way. And so I told them my full story, and they said, well, you have to actually do full mentorship and give them exactly what your mother gave you. And so I said, all right, this is going to be a different journey than what I initially thought. I thought it would be more of a financial transaction deal. And I realized that it was going to have to be a lot more sweat and time that goes into this. And so I didn't have connection with boys in the community. I went to the park. I think it was Digby and Pontchartrain Park, tapped the coach on the shoulder, said, hi, my name is Sonny. I want to help mentor boys. Do you have any boys here that are growing up without their fathers? And that's how we got our first 5 boys in the program back in 2011. And so we built out our logic model and started working ever since. So for me, it was a personal story, and everything that we do is built off of what my mother gave me.
That's amazing. You've all talked about some pretty incredible things that you've done, and as you took those bold steps and big actions, were there unexpected challenges, anything that you learned through that courage that you'd like to share with the audience? Go on. You got it.
When I started my career in healthcare, I started it as a housekeeper, working in housekeeping. My mother went to the HR department, don't try this at home, and she said, my other daughter needs a job. She'll do anything, including sweeping the parking lot. And I often wonder if she had said she'd do anything, including running the hospital, if I would have gotten into administration a lot faster. But there was a day that I was cleaning a unit, and there was this one patient that was intubated and was not conscious, and there was a lot of beeping that was going on in the room. I was in nursing school at the time. And the next day that I came into the room, there were doctors and nurses standing all around, the patients beeping, everything was going off, and they're having this conference saying, well, what happened? What happened in the last 24 hours? Something has changed. This patient was doing fine. And as I was eavesdropping in the bathroom, as I was cleaning the toilet, I knew that I had done something different in the room, and this is really going to age me. The housekeeping department had gone to a new air freshener in the room, and it was a little bottle of oiled fragrance that had a little sponge that you pull it up with. You all know what I'm talking about. And it would dissipate into the room. So I knew that I had put a new air freshener in the room. And so I struggled for about 3 seconds. Do I go out and tell all these big, important people that I think I know what may have caused it? But being in nursing school and recognizing that my mother had raised us to understand that being a leader has nothing to do with your title. It has to do with what you are able to do in the moment when it's needed. So I imitated my mother and I walked out into the room and I said, I know what has changed in this room, and they didn't pay attention to me, and I said it louder. I know what has happened in this room that's new. And I went and got the air freshener. I said, this is new. Maybe the patient is having an allergic reaction to this fragrance. And so I said, I'm going to take it out of the room, I'm going to bring a fan, and we'll aerate the room and see if the patient's vitals come up. And they just kept looking at me with question marks over their head. So I just did it. And literally the patient's vital signs started to change literally in the moment. And that's when I really recognized that it's not about what your ID says, it's about who you are inside and when you're ready to take that bold step when it's needed.
Again, I don't want to follow her.
All right, I guess I'll go. Wow. All right. I think for me, things that surprise, we're a nonprofit and it operates like a business, right? I mean, obviously the support goes to the boys, but you still need all of the back office items. You know, you need HR, you need accounting, you need transportation, logistics, and so marketing, all of these things. And I think for me, that was really, when we were building it, just a surprise of how alike it was. I would say also, I got into this to really be with the boys all the time, and that changed halfway through. We're 13 years old, where I'm the ambassador of the organization, right? Obviously setting vision, and so my journey as a leader, I've had to become aware of so many things. It's like every 2-3 years there's a new thing that I discover about being a leader and what I'm supposed to be doing as we grow. So I don't have the connection with the new boys as much as obviously the first 40 boys, where I was going to pick them up from school, going to their games or their music recital and having conversations with them at the ball game as much. And so I do miss that. But I will say, seeing my alumni come in the office that are 22, 23 years old, I mean, I'll shut down and shut out everything to just have moments with them like that, just to see them coming back because they're choosing to do that, right? It's also great to see our boys who are excelling. I mean, we have a boy at West Point right now that is doing amazing. He's a senior running back there. But we also have a boy that is just trying to find a job and get through. And so for us being there for them and knowing that success is different for every kid is something I realize as well. And, you know, it was always you had to, you know, be the best. You have to graduate college and you have to have this job, and sort of like my mom did for me, right? But it really looks different for every child because they're dealing with so much obstacles and challenges. And so I would say that. I also say in my role, it's really identifying leaders as well and lifting them up and giving them the opportunities. I'm talking about within staff, right? Because those are really the people that are going above and beyond every single day and spreading our message and being the point people for our boys and the guardians. So identifying the right staff and really nurturing them up to leadership is something that I really, really enjoy as well.
Dr. Rolfsen.
So again, I feel like low man on a totem pole here with all these great stories. But, you know, you said challenges and surprises. I guess the challenge, negative I won't spend a lot of time talking about, is I guess I didn't realize how much politics comes into play with the decision to feed hungry kids. That was a surprise to me, and it was a challenge that we, I guess, still deal with. But from a positive thing, good things that happened is slightly surprising was I didn't realize how many people were already working on food insecurity. I mean, I don't have food insecurity, right? So I wasn't aware of it. I'm kind of out of my lane in this area, so it's been a whole new learning experience for me. But there are so many people already working, different organizations in our community that are working on trying to help kids and families have access to food. So finding out those individual little groups that are, and again, not being critical, they're almost like silos that weren't necessarily talking to each other. So by coming together, I think it really gave us a synergy that I think we're starting to see some more results and get some actions being done and some good things happening by coming together. But the fact that there was people already working on it that then spun off to get more people in, and like I said, it was just a cascade that really got pretty big as far as the number of people that are involved and wanted to be involved in efforts to decrease food insecurity in our community.
You know, leadership is really hard, and I want to get vulnerable with all of you for a second, and I'll start with Dr. Rolfsen, who I was able to work on the front lines during COVID. We did nightly calls, all the hospitals, and as a Ochsner in the Baton Rouge clinic, we were able to just work together on addressing the pandemic. And so I got to witness his leadership front first and foremost. But I'd like to hear, how do you handle moments of doubt or fear, especially in big, challenging situations like that? What keeps you going? How do you push through it when you feel like giving up?
I guess your initial introduction where you talked about the courage and everything it took was kind of scary. I don't think I want to do that the way you described it. So I don't feel like it was all that difficult. I think part of my issue is I've always believed and always heard that for those who have given much, much is expected. And I kind of don't like the fact that I've been blessed with so much because I feel like I have to really do a lot more. And I keep getting more blessings and more blessings. I'm like, stop, I got enough. But I think part of it is that I feel like I truly feel the need to give back, and I feel like there's a lot of opportunities I've been given. And also, things just happen to come my way. John Spain made the comment, and I happened to be friends with Mike Manning at the Food Bank and Pat Van Berkeley feeding in Louisiana, and just had these connections that allowed me to say, let's get people together. Bill Cassidy and I are friends, and his office is helping us, Jay Darden. So it's just like I happened to, for some reason, God put these people in my life and gave me the ability to make connections and make these things happen. So it's kind of like, almost like I didn't have an option. I felt obligated to do these things.
I'm going to save Dr. Flowers for last. Sonny?
Oh, yeah. The closer. So for me, I think it's having a group of folks that I trust and that have been with me along the journey that I can always go to and share what I might be dealing with at the time or some decisions I need to make. I've always done that. All right, Pete or Ola or my wife, Rosie. I mean, I go to them and really have conversations, and they always keep me grounded. They always suggest things that are fair, and, I lean on that. And so for me, it's that. I also know that I have to have courage for my boys and my mom, the single moms, and even the donors. They have to have confidence within of me to go out and make the best decisions. It is hard, but I know that I was raised well, and so I just lean on that.
Dr. Flowers?
I feel like I've been set up. I think I agree with what both my colleagues on the stage have said. I think for me it is recognizing that I don't view my work as work. I think it's a calling, and that is an internal grounding for me. Having a network that I can be vulnerable with. Also, my leadership style is servant leadership, and so I'm very transparent with my staff. I let them know when I've got difficult decisions to make. I ask them to assist me, give me your ideas. How can we make this better? Because again, as a leader, my job is to make sure that my staff has all the tools and resources that they need to be successful. and to provide vision for that and to be supportive. So when those moments of doubt and fear come, and they come often, it is recognizing that because it's a calling, I always view it as hard work, but it's also heart work. The satisfaction that we get when, perhaps when we did a fair and found out that there was a gentleman that had a blood pressure of 200 over 100 and something, and that literally, because we were there, even though we had to get up at 5 o'clock in the morning to be there for the fair, that's one life that may have been saved. And so the satisfaction comes in recognizing that although we cast a broad net out, and we're prayerful and hopeful that we're making a difference, it is the returns that we get when we find out, whether it's an email, whether it's someone saying, hey, remember that health fair? My husband's still alive. So I think it is having a place where you can be vulnerable, not having the attitude that you know everything, being able to include others in your decision making, and recognizing that if what you're doing is not a calling, it's really not going to be successful.
So the theme for this panel is owning it. I'd love to hear from each of you. What do you think that really means to own it today as a leader? Anyone can go.
I'll start. Like I said, this kind of just came. I wasn't looking to work on food insecurity. It just kind of came to me. I think everybody out here is going to have something that comes to them sometime, whether it's today or next week or next month, that you're going to see a problem in your community that you could do something about. And so I think it's a matter of taking ownership and recognizing that everyone here has a role to play and can do something to make our community, our state, a better place. And so I would challenge you to, when that comes in front of you, and it will, recognize it, and as Christy said, own it.
Yeah, I think for me, you're going to get a lot of positive and negative that come your way sometimes, right? I mean, as leaders, we get the pat on the back, but also when maybe we make the wrong decision, or maybe a team member does, we have to go in and own it, right? I mean, we're the leaders of the organization, and so I think for me, it's really that. I'm always like the good guy in my organization. I have my CFO is the bad guy, but at the end of the day, no matter what his decision is or a director, I understand that I have a big part in that as well. And it's maybe did I have the conversation with that leader beforehand to set up what the expectation was. And so I think owning it just means the positive and negatives that come with being in the position.
Well, I think for owning it, for me, is I spend a lot of time in my head. I do a lot of reflection, introspection, evaluation. Owning it is taking it out of your head or moving it from your heart to your head to your hands, to actually taking it from the place of a thought to an action. And it is, I think it's sometimes very difficult. You feel like a salmon that you're swimming upstream, but I think that the issue is that all the good stuff is in the scary places. So pushing past your fears, pushing past the obstacles that are going to be presented to you, and recognize that the outcomes are really what matter. And as you are keeping true to your own internal compass and what your heart is telling you to do, and in the places where you can have a voice, to be willing to be bold, to say what it is that you believe is true, and to even make the business case for those things that you may get opposition on. So doing the work internally and bringing it out to actually get out of your head, bring it from your heart and get it into your hands.
I think it's one thing to own it and lead, but all of you are also leaders of leaders, right? You're all leading others, and I would love to hear any stories you may have of ways in which you helped to develop one of your leaders or someone that you work with or mentor, and who maybe didn't have that courage, and how did you take them and encourage them to embrace courage and own it themselves?
Yeah, I'll go first here, if that's okay. No, just my development director, actually, her name is Maddie, just popped in my head. Maddie graduated Tulane probably about four or 5 years ago, and she has a job of raising about $6-7 million a year, you know. And she started off as a coordinator, and then my director of development moved to New York, and then, well, I'm sorry, right after the coordinator, she rolled into our partnership manager. And our director moved to New York and said, I think Maddie can take on this role. And I didn't think so at the time, because I said, well, she's younger, hasn't had that experience, but I trusted my director of development, Lila, who moved. And so put her in that role, and I have a ton of meetings with her, but I found a mentor for her, which I think is the biggest outside of myself, right? So I think that's been the biggest thing in her development. And so it was really finding somebody else that can really work with her that's not in our industry, that's in fundraising, but not necessarily our space, so that she can hopefully grow within it. She's doing a great job.
I had an administrative assistant in another state, in another role, that was just the best undercover person you could think of. My first 2 weeks there, I had 10 people at my door, and I didn't know who was telling them that I was there, but she was leading people to me who had issues that needed to be resolved. And I recognized that she was doing all of this under this cloak of quietness. But I also recognized that there was an opportunity for a trainer that came about that eventually was going to end up reporting to me. And I told her that I felt she needed to apply for the position. I gave her a little help around developing a presentation she had to do, and she got the position. Ultimately, we talked about the fact that we both wanted to be life coaches. And there came an opportunity for our system at that time, wanted to build a cadre of coaches. And so they called me and they said, hey, we'd like you to come and be one of our coaches for the system. We're going to give you training, you'll get credentials, blah, blah, blah. And so I said, well, can you do 2 people? And they said, no, only 1. Well, my administrative assistant didn't have a degree, and I had a couple at that time. And so I gave it the opportunity to her. And what happened was she became the star pupil out of our systems class. She ended up providing training for our system for about 5,000 people. And the organization that did the training for our system approached her and asked her if she would also do training for them. She has now become one of the hottest, and check her out on Facebook, her name is Kathy Mott. She is one of the hottest growing national accredited life coaches. She does a lot of work for our system, and it is amazing because what she says to me all the time is whenever I'm asked who was my favorite boss, she say, I tell them it's you, but I never let anybody call me boss, so she always calls me her sob, which is boss spelled backwards. And so as Kathy has trained professionals, she's trained across the country, she's trained in South Africa, in Paris, all across the world, but she always comes back and tells me, you know, you changed the trajectory of my life. And all I say is, I was just being me, and I saw what was in you.
So I guess slightly different. I don't have any stories of people that I, quote unquote, helped, you know, increase their leadership ability, whatever. But I feel like, again, in this alliance that we have, pretty much everybody involved is already a leader in their own respect, but just needed some encouragement to do things. And so everybody, again, this group has kind of taken off. There's a group meeting next week on food as medicine, which is a project to kind of to help food insecurity. There's another group that's working on SNAP benefits. I mentioned our name itself was a small group that broke off and tried to get a good name for us. So I think just these people everybody involved is just excited about doing the work and just kind of encourage them, giving them the freedom to say, yeah, go ahead and do that. It's kind of, sometimes leadership just is by loosening the reins of people to let them take over and do things that they really want to do, but wasn't quite comfortable that they were, you know, empowered to do that. So just kind of saying, yeah, you take it and do it. So yeah.
I think everyone in the room can see that each of these individuals has courage and has led through just amazing situations. I would love to drill down on a specific example of where you felt like you demonstrated courage as a leader and what that impact looked like.
Being here today.
Okay, so I'm gonna let you in on a secret. So I have dyslexia, and I struggled when I was younger. I could speed read if I read silently, but speaking and reading in front of people was terrifying for me. And my family has a very strong faith-based foundation. And it was through my church that I was always being thrust in front of people. And I hated it. And I finally realized that being pushed to do the things that were uncomfortable helped me to get over this issue of dyslexia. So now that I would tell you the one time specifically that really helped me to know that I had gotten over it is I had to do a presentation for the American College of Physicians. And when you think about all the multisyllabic words that are in medical terminology, initially it was petrifying, but I realized that the information was so important, it was more important than the fear that I was holding on to. So every time that I have to speak, every time that I have to read in public, that little voice that says, don't forget you've got dyslexia, I always see it as a hurdle I have to jump over. And doing it every time, at this point now, I'm okay with it. But I never, I like telling people about it because I'm not the only one that has, and I won't even say a disability, but has a challenge that you may not be able to see. You may not see me in a wheelchair or a crutch, or having any kind of physical challenge, but that is still a challenge for me. And I think being able to rise above that, push past that, but also tell people about it, because nobody ever believes that I'm shy either. But the fact that reading is still a challenge for me, and the fact that I have a couple of doctorate degrees, I think that's kind of proof that I've gotten over it.
Yeah, I would actually piggyback right off of that because most people don't know that I struggled a lot with anxiety in college. I sat out actually 2 years because of it. Went to the doctors, things like that, tried to really see what was the issue. For me, I would sweat a lot, so you could see it. I'm surprised I'm not drenched now. I'm glad that the AC's pumping in here, but
You're the only one.
yeah. But a lot of people just think I'm a social butterfly, and it's all good. And Sonny, you struggle with anxiety, and so for a period of time I did that. I was at my mom's house and I was depressed, and I was eating a lot, and it just wasn't a good time for me. And so I think the courage that I had was really putting myself in those situations where it was a crowded space, and I felt comfortable. And so I bulldozed through that, and know that even now I have to go and give speeches all the time. I have to talk to people. I have the light sort of shine on me whether I want it or not at different times, and you never know when it's going to happen. And so it doesn't go anywhere. I just know how to manage it a lot more. And so I am vulnerable with my boys. I think most of my boys, especially the older ones, know that about me. Most of my staff knows that. But I think by them seeing me still doing it helps them as well, overcoming the challenges that they may have. So.
Anything else, Dr. Rolfsen, or are you going to keep that answer? Okay. I only have two more questions. And this next question just stays in the room. It'll never go out. But I just want to know, what is the next big challenge that each of you wants to tackle? And I assume yours is grandchildren, the new grandchildren and whatnot. But I feel like, what are we going to read on your LinkedIn post in the coming years? What's the big thing you want to tackle?
I think for me, I'm writing a book right now, which is something that I'm chapter 6 of 13, so hopefully it gets finished soon. But for me, it's really, I want groups and organizations around the country to really see our program as one that they can adopt a lot of our teachings, right? So it's more teaching in tech for us. We do have groups from across the country that currently come to New Orleans to learn our model, and we just give it out free, right? But for us, we have, just so you all know, boys join around age 10. Most of their fathers are lost to violence, long-term incarceration. We have a case team model where Each boy has a case manager, a mental health specialist, a education coordinator, a mentor, 30 activities a month that they can choose from. This is all in-house, and it carries them all the way through for several years. And it's very tough to do that work. But for us, we want groups to develop something where groups learn and can, my phone's ringing, sorry about that, where folks can take our model and use it in their cities. It's not necessarily have a son of a saint in Denver or something, but it's them to be certified, I guess, to be doing this work. So, yeah, continuing education.
Great.
Well, one day in the not so distant future, I do plan to retire. But I think the next big thing for me is the reason why I came to New Orleans is to see us move from the bottom to the top of national health rankings. So the fact that I can play a role in helping us move up, that's the biggest challenge that I want to really focus on for my next years. And a lot of my staff are in the room. I'm not retiring soon, but it's coming. But during the time that I'm here, that's really what I'm looking forward to doing, is seeing us move from the bottom to the top.
Well, you're in the right place today. That's good. Dr. Rolfsen?
Yeah, again, I'll copy Dr. Flowers. I mean, I feel like maybe also the retirement, but maybe not as near as, I don't know, as your plan are. But at my current stage, I feel like it's like, gosh, we've got to do something, you know. And I feel like there's so many opportunities we have to make our state better, and yet there's not enough time in the day to tackle all of them. So it's like, which ones do you tackle, you know? And again, I kind of fell into food insecurity, but whether it's violence or poverty or economic development or smoking cessation or cancer screening, there's so many things. It's overwhelming, and so I guess the challenge is to get everybody involved. So all of you have to pick something and help to make it happen, because we do need to bring our state up. We need to go from 50th to 40th or higher. I think that's a big goal, and anything I can do to help, I'd love to do.
Great. Last question from me is, you've got this entire room to inspire. What advice would you give them to tackle these big challenges, whatever challenges they're focused on or that they want to lead? Any last words or advice?
I'll just say one step at a time. When I first started Son of a Saint, I wanted to help thousands and thousands of kids. I called my uncle, and he said, just help one. And I've been doing that, and I think just taking it one step at a time.
One of the things that I would want you to walk away with from today is what is kind of typical of people in healthcare is that we're always reaching out to help others, but we often lack on helping ourselves and making ourselves a priority. That's something that I've worked on a lot this year. And I would say in the process, don't forget about you. Make time for yourself. Decompose, de-stress. Take time away from work. Don't always take the computer home. And I'm working on that too. But make sure that you are caring for yourself, because if you don't take care of you, how can you take care of others?
You know, I think it's important to the World Health Organization defines health as a state of complete mental, physical, and social well-being. And I think, and not just the absence of a disease, not just the absence of disease, but a state of complete mental, physical, and social well-being. And so, in that, you know, that whole gamut there's something that every one of you has something you can do, and you know, don't think it's too little. So. If you're a bicyclist, bike paths. Are there bike paths in your community? You know, there's something that you might find that you're passionate about. It is involved in health. Everything affects your health, from the economy to the environment and everything else. So find something that you're interested in and just start working on it. And you'll be amazed at how many other people will join you if you just raise the flag and say, hey, let's do this. So I encourage everybody to do something. Pick something and make it happen.
Very good. Thank you all. Let's give them a big round of applause. I hope that you've thought about your own journey with courage and leadership. These three are available for bookings and signings and whatever else. And it sounds like you're all locked into Healthy State. So I want to thank you on behalf of the Healthy State organization. So thank you. All right, John.
Dr. Rolfsen told you the story about a meeting we were in where I made this outburst about having people in our community go to bed hungry each night. I too have given a great deal of thought about what caused me to make that rather abrupt, loud statement in that meeting. And I've thought about it for some time, and frankly, I've prayed about it some time. And as I hear the doctor talking about what he's actually done, I've come to realize that that was not an accident, that we were put in a room together to hear about a crisis, and that the people in the room called attention to it, me, and there were people in the room, him, who actually had the resources, the connections to respond to that. And he took up that call, and as he told you, he networked with people and organizations that are still meeting with him in his office on a regular basis to determine how we make sure that no one in this community goes to bed hungry each night. So you never know, where that moment's going to be. And one of the things that has been around for a long time that has reminded me and guided me at times is that old saying that says, ask not for whom the bell tolls, it tolls for thee. And you need to remember that each of you have talents, skills, and experiences that in that moment when that call is made, it might be calling you and you don't know it. When I talked about people going hungry, it wasn't my intent to have Dr. Rolfsen get involved. But it happened in that moment. He heard it. He felt compelled to respond to it. And he's brought together people from around our community that are making a significant difference in making sure that we don't send people to bed hungry each night. I think that's a really good lesson to take away as we think about why we're here today and know that each of us is in this meeting today for a reason. And that reason means that when you leave here today, you take what you've learned, you work with other people, and you too can inspire others to do other great things in your community. And you never know when that moment is going to be. So, none of that was scripted. Thank you to that panel. We're going to take a 15-minute break, and then we're going to move to the breakout sessions starting at 1:45. Those are going to take place in the Governor and Capitol rooms just down the hall from the ballroom. The sessions will focus on Live It, Communities in Action, and we have 2 tracks, so pay attention. Track 1 will be Disruptive Innovation in Food Security, followed by the impact of workforce development on improving health outcomes. That will take place in the Governor room. Track 2 will be Emerging Technology for Health Equity, followed by Smoking Prevention in the Capitol room. There's still so much to do, so many more shared experiences in the day ahead, but since I have you all here together, I want to thank you on behalf of Ochsner and our sponsors for being a part of this great changes ahead for Louisiana. It's going to take all of us. Now go to the breakout sessions. Let's see how we can work together for a healthy state. Thank all of you for joining us here today and being part of the movement for a better Louisiana, a healthy state. Give yourselves a round of applause. Thank you for being here.